Hi, for those of you who don't know me, I'm Dr. Craig Rubenstein. I practice both in Medford, Long Island, and on 46th Street in Manhattan. This is a case from approximately 25 years ago, but I remember it quite vividly because it really blew me away and taught me something. It taught me that no matter how bad or difficult or even impossible a case seems, that I might be able to help, and not to write the patient off, but at least to try. This was a case of a woman in her mid-80s who was brought into the office by her daughter and son-in-law. I have to say, she looked terrible, exhausted, and semi-incoherent. Her symptoms were as follows. She was sleeping approximately 20 hours a day, and for the few hours that she was awake, she had a difficult time holding any food down, and she was throwing up. And when she wasn't throwing up, she was dry heaving. She was also quite dizzy and was falling quite regularly. She sat in front of me with her mouth hanging somewhat open and with a glazed look in her eyes. I was told that she was taking approximately 15 different medications, some of which they were not sure if she was even holding down. Sitting there, I thought to myself, why did you bring her here? This woman looks like she will probably be dead in 2 weeks. And how do you expect me to help her? And then I decided that she was here and I would at least do some type of an exam and treatment. I found a pelvic problem, and due to my studying with a particular chiropractor by the name of Dr. David Denton, I knew there had to be an associated problem where her food tube or esophagus meets the diaphragm and the stomach. In applied kinesiology, we would call it a pseudo-hiatal hernia, although sometimes it's an actual hiatal hernia. The treatment that I gave this woman was quite simple. I corrected her pelvic problem using what are called blocks or wedges from the technique called sacro-occipital technique, or SOT. It is a very low force treatment using her body weight and gravity. I then performed a type of visceral manipulation where significant pressure is applied in the epigastric or solar plexus area of the upper abdomen, combined with a sharp downward thrust. And then I also corrected a few other spinal problems with my activator instrument, which many of my patients call a clicker. That was on a Friday. And I set up an appointment for her again on the next Monday. And I was 100% shocked when this woman walked into my office on Monday afternoon, quite coherent, explaining that she had not thrown up since I had last seen her, although she did have a few dry heaves, but was down to sleeping only 15 hours a day, and the dizziness had lifted. I really could not believe my eyes or my ears at that point. Amazingly, after just a few other treatments, this woman who I believed was at death's door got back to driving and lived another 7 years or so and died of unrelated causes. She wrote me a beautiful testimonial, but her case taught me an invaluable lesson. Years later, I was reading someone else's work where they described how a hiatal hernia or pseudo-hiatal hernias could cause a whole syndrome or complex of symptoms. When I read through the symptoms, I realized this was exactly what this woman had been suffering from. Now, I treat these types of things all the time, but rarely do they cause more than belching, some reflux, a little bit of a cough. I don't think I'll ever see another case like it.